Okay. So you can take that every 6 hours. So
Inside the place she's called home for so many years, 98-year-old June Jones knew something was wrong when the pain she was feeling just would not go away. Her granddaughter called 911. But instead of a trip to the emergency room, June is being treated at home in the comfort of her living room by the staff and resources of West Metro's Arm Car or Advanced Resource Medic.
Well, you don't want to take too much of it.
It's like an old-fashioned house call, but in reality, much more than that. Not only will June get medical treatment on site, she'll be connected to her primary care doctor for follow-up and be connected to community resources that can help her continue to live independently.
they're willing to get like a home health aide to kind of come help you with just some things around the house here and there and just make sure that you got everything you need.
This program is all about bringing urgent care to people's homes, really providing the most appropriate treatment that we can in the most efficient manner. So ma'am, I'm just going to poke your finger, and then here soon my partner, who's a physician assistant, is going to come in and take a look at you.
Okay.
The Arm Car is a public-private partnership with Dispatch Health, and Dispatch Health provides a nurse practitioner or physician assistant who teams up with the West Metro Advanced Practice Paramedic.
I've been in healthcare for 15 years, basically as a paramedic as well as a PA, and I've worked in a lot of different environments, and this is the first time that I feel like I'm appreciated, like truly appreciated, and people are just really gracious and excited about the service.
There's a change from what your normal is, and I am very concerned about you.
The idea is that we can capture patients who don't need to go to the ER but have called 911. And in order to do that, we utilize the 911 system and our crews, which let us know that they have a patient who would be appropriate for us. And through that, we're able to alleviate the calls somewhat on the 911 system and provide appropriate treatment to these patients, which is in the care of their home or their office, wherever they're at. And that helps the system as a whole, be it 911 or the hospital system itself, to free them all up to see patients that are more critical in nature.
Special equipment on board and the team's expertise gives them the ability to diagnose and treat a variety of illnesses and injuries, resulting in lower healthcare costs and more appropriate treatment for the patient.
The value is that you're providing a really compassionate, competent, safe, convenient service.
I think this was really an amazing experience so that my grandmother could stay in her home. It was a big anxiety of hers to go to the emergency room and possibly not be able to come back home for the night. And I think she got all the medical attention that she would have gotten, if not more, as far as resources and personal attention from this service. Was this a better experience?
Very much better.
The impact that we've made in those patients' lives, I think, speaks for itself.